economic, and political responsibility. By acting early and decisively, we can prevent disease, reduce healthcare costs, and improve the well-being of future generations. The evidence is clear. The tools exist. What is needed now? Commitment to action. Thank you.
Vielen Dank. Für die Renew.
Thank you very much. And now for the Renew Group, I call Mr. Vasile Voiculescu.
Frau Präsidentin, colegul Veriga tocmai...
Colleague Veriga was talking about, asked, where does health start? Health starts at home, in school, and often in the kitchen. Obesity is presented as a result of wrong individual choices, but the reality behind it is more complex, as we all know. It's not a choice. It's a result of social, economic, and environment conditions. And we like to say that we're all responsible for our own health. To a certain extent, that is true. But what happens when the healthiest option is also the most expensive? This happens all too often. We have the information, but we don't have the money. Let's think about a single mother with 2 children. She works a lot. She wants the best for her children, and she knows that it's important to have healthy foods. But when she has to choose between cheaper foodstuffs and more expensive ones, she has to choose the cheaper ones because she just can't afford it otherwise. So we need to keep these realities in mind. Preventing obesity is not just awareness campaigns, but is having access to affordable foodstuffs, to gyms, and support for vulnerable families. This is where our political answer starts. Thank you very much.
Thank you very much. And now for the Greens, Mrs. Metz.
Herr Präsident, die Commission. Luxembourg.
President, Commissioner, in Luxembourg, 1 adult in 5 suffers from obesity. And this number has been on the rise over the last few years and continues to rise. Now, sometimes say that will is enough to fight against obesity, but that is not true. This is a real public health challenge. Obesity is linked to diabetes, cardiovascular illness, and social inequality. And we should focus our efforts on what really makes a difference. Access to healthy food, balanced diets, physical activity, and prevention policies that reach everybody. We can't expect medication like Ozempic solving the problem for everybody. Access to medication against obesity should be limited to people who have a real medical need for it. The solution is to be found in creating environments in which healthy choices are the easiest and most affordable ones to make for everybody. That would mean that we should make food something that's at the service of health. We should prevent aggressive marketing of unhealthy products and instead offer healthy food in schools. Obesity and the associated conditions should be one of those problems that we prevent, not just that we treat.
Thank you. And now for the Left Group, Mrs. Martins.
Thank you very much, Madam President. There are 2 issues related to obesity we have to address. It's not just a question of individual choices, and it's not something that we can just address with public health policy. In reality, as a society, 8 million people live with obesity, and we know that a big proportion of them are children, and there are untimely deaths because of it yearly. We know the reasons are complex, but the causes are a number of environmental factors, economic factors, and social factors. We know that there's ultra-processed foods that are cheaper, but they are not healthy. And we know that with unregulated employment and low salaries, people have no other choice. Sports are expensive. Everyone is cutting costs, and everything is in place, therefore, for obesity to continue to rise. Mr. Commissioner, the Commission's policy are a big part of the problem. Now, there are innovative pharmaceutical products. They help. but we have to make sure that they are affordable for all. It's not a decision, a health decision that we can delay. There's not a single pharmaceutical product, however, that will mean that we don't have to look at the principal issues. We must change a lot. We have to make sure that healthy choices are affordable and not a luxury. The price of fresh food is a huge burden for families, and this is unacceptable. Clearly, we need to have the courage to regulate the market and to make sure that food that is not food isn't sold as food.
Thank you. And now for the ESM, Mr. Jongen.
The obesity epidemic is a disaster. 60% of men and almost half of women are overweight, and many morbidly so. It's not much better in the EU, and that's linked to cardiovascular diseases and diabetes. The problem are ultra-processed foods full of carbohydrates and sugar and unhealthy fats, and a sedentary lifestyle in front of screens. Food companies are earning billions, but millions are dying as a result of obesity. More than die in word or malnutrition combined. It's hypocrisy to have these lockdowns during COVID. That made the situation much worse, particularly for young people who were then condemned to a lack of physical activity. It's not just research we need, funded by the EU, but we also need to push local agriculture for fresh food in kindergartens and schools, and we need to promote sport. Prevention is the key word here. Transparent labelling, like the Swedish keyhole system, less sugar, less bad fat, that would be better and give people a choice in what they eat. In the US, things have gone further in the wrong and right directions. The food pyramid from Mr. Kennedy is based on healthy food and fights against profits in favor of healthy food. Make America healthy again. That's fighting obesity at the root cause and is saving money on a health cost.
Thank you. That concludes the speakers on behalf of the political groups. And I call Mrs. Paul Fjord. Thank you very much, Madam President, Commissioner, dear colleagues. A majority of the population in Europe is now overweight, and approximately 1/5 struggle with obesity. And the trend, or the direction of travel, unfortunately, is going in the wrong direction. Every week, we also see new statistics on obesity and problems with weight amongst children. And of course, this means further problems, cardiovascular diseases, and so on and so forth. So we need to fight this, and we need to fight the phenomenon of excess weight and obesity, and particularly break this trend amongst young people and children. And for that, we need to intervene in various areas, and we need to start right from the beginning, provide people with healthy food, physical activity, exercise, and to do this from an early age. It should happen at schools. It should also happen in people's leisure time. And of course, we also need to change our perspective. Obesity isn't just the result of poor lifestyle choices. It is also a disease, which means that we can't just focus on prevention. We also need to make sure that we deal with treatment and care. Obesity is a challenge for our societies, for all our societies in Europe. We need to work together. We need to prevent and we need to counter. And we also need to learn lessons from each other's experiences in this domain. Together, I think we can build a more healthy Europe for the future. Thank you. Thank you very much. I now call Mr. Lupo.
Grazie.
Thank you very much, Madam President, Commissioner. Members of Parliament, a lack of physical activity is one of the major causes of obesity for young people. The WHO recommends for young people at least 1 hour of physical activity per day and a weekly sporting activity. Unfortunately, because there just aren't enough facilities, young people in disadvantaged areas are not able to access free sporting activities. Therefore, Europe should invest in building sporting facilities that are freely accessible to all. One of the major points in fighting obesity is the right kind of teaching about food, so that we base our food on healthy products that are available in all school lunch rooms. It is important for Europe to invest to make sure that food security is upheld at affordable prices for all European citizens. Thank you.
Vielen Dank. Nächste.
Thank you very much. Next speaker is Mrs. Brasier-Klein.
Merci, Madame.
Thank you, President, Commissioner. Obesity is a scourge which leads to other conditions like cancer, diabetes, cardiovascular illnesses and mental health problems. 25% of Europeans are affected by this. It's a real societal problem which can't be solved just by using slimming medications. They're treating the symptoms, not the causes. We have to reduce the amount of fat and sugar in our foods and allow citizens access to healthy and affordable food. It can't be considered normal that in the peripheral regions, foodstuffs are heavily loaded with sugar, creating more obesity. And prices are higher because these are often island regions. So what can we do? We need to stress prevention from youth onwards. We have to fight against sedentary lifestyle and the use of ultra-processed foods. We need to treat obesity as a chronic illness, and we need to better offer care. It's too fragmented at this stage, and we need better accompaniment of individuals in the long term. This is a social and economic burden for health systems. It's a real public health issue, and we need political commitment to this cause. Thank you.
Dank.
Thank you very much. And the next speaker is Mr. Picaro.
President, colleagues, obesity is one of the major health challenges that Europe faces currently. 1 in every 6 Europeans lives with obesity, and 1.2 million deaths are related to the fact that people are overweight or obese. Therefore, we need structured health policy. For this reason, we need 3 things. The first, recognize obesity as a chronic disease, moving away from simplification or stigma. Second, strengthen screening via the Safe Heart Plan to make sure that there is early diagnosis to prevent cardiovascular disease. Third, guarantee access to treatment and innovative methods for addressing obesity in all member states. Italy has already set forth a path. It is recognizing obesity as an illness with an integrated policy in Italy. Now we need a stronger European approach to prevent and treat obesity, to cure it. That means protecting Europeans' health and our health systems.
Dankeschön.
Thank you very much. Next speaker is Mr. Holmgren. Thank you very much, Madam President. Commissioner Hoekstra. Excess weight and obesity, I grant you, have something to do with treatment, care and medicine, and those who are affected need to be supported and helped. But at the same time, it's also a money-spinning industry. You make billions trying to chase some kind of completely unachievable target or ideal. I take the example of Ozempic, just by way of an illustration. I think that we as politicians need to look beyond that, need to address these issues properly, understand that public health is a matter of politics, and we need to do much more on prevention, and that is precisely what you said, Commissioner Hoekstra, in your introductory statement. You know, we can detect clear patterns in this area.